Every year in the United States, up to 900,000 people are diagnosed with deep vein thrombosis or DVT, and as many as 100,000 of them will die from complications. Most of these deaths are due to pulmonary embolism, which is a sudden and often fatal event where a blood clot travels to the lungs and blocks blood flow. To put it in perspective, DVT and pulmonary embolism kill more Americans every year than breast cancer, AIDS, and car accidents combined. And here's the terrifying part. Many of these people don't even know that they have a blood clot until it's too late. Today, I'm diving into one of the most dangerous yet preventable vascular conditions out there, deep vein thrombosis, DVT. What is it? Who's at risk? And most importantly, what can you do to protect yourself and your loved ones? Let's get started. Deep vein thrombosis, or DVT, happens when a blood clot forms in the deep veins, usually in the legs. These are caused by a collection of blood cells clumping together and attaching to the lining of the vein and eventually causing an obstruction. These clots can cause pain, swelling, redness, and a sense of tightness or heaviness. But sometimes they cause no symptoms at all. That's what makes DVT so dangerous. A silent clot, which can suddenly break off, travel through your bloodstream, and lodge in your lungs, basically suffocating you to death. And that's a pulmonary embolism, a true medical emergency. It's often fatal within minutes. Now, who's at risk? There are several major risk factors, prolonged immobility being one, like long haul airplane flights, car rides, or even prolonged bed rest. Surgery or trauma is another risk factor, especially orthopedic procedures like hip or knee replacement, even after a major fracture or break, like a broken femur. Cancer treatment and cancer itself can be a risk factor. Pregnancy, especially in the postpartum period. My father was an obstetrician and he unfortunately saw a number of DVTs and pulmonary embolisms in his 40-year career. Obesity puts us at high risk for DVT because of the extra pressure put on some of the large veins, especially in the abdominal area, which slows down blood flow. Smoking damages blood vessels of all kinds, as you know, and it causes injury to the lining of the vein, which increases clotting. Hormonal therapies like birth control treatment and hormone replacement can also cause deep vein thrombosis. And then there are genetic issues like factor V Leiden or protein C or protein S deficiency. We call those disorders thrombophilias, where the body, quote unquote, loves to make clots. Varicose veins are another risk factor. In my practice, I see this all the time as a varicose vein specialist because the veins are dilated and twisted and tortuous, and therefore the blood flow is not what we call stream-like or laminar, and the blood from just rolling on itself can clot off. A history of having had previous DVTs is obviously another risk factor for new deep vein thrombosis formation. And superficial vein clots, what we call SVT, superficial vein thrombosis, or phlebitis, is also a risk factor for deep vein thrombosis. When you get any kind of a clot, even in a superficial vein, that leads to a cascade of events inside of the bloodstream that we call the clotting cascade. And chemicals are produced that lead to more clots. And one study showed that people with superficial venous thrombosis may actually have up to 30% coincident deep vein thrombosis, meaning at the same time, you may have an unrecognized deep vein thrombosis. So people with superficial vein thrombosis and phlebitis should always be checked for deep vein thrombosis. And one study I read showed an amazing fact that people with superficial vein thrombosis or phlebitis may not only have a DVT, but that DVT can often be found in the opposite leg. So it's not just an extension of the superficial clot into the deep system. It's that clotting cascade that has been set into motion that can cause a clot in the opposite leg or in another area of the same leg. So these are all things to keep in mind because the body's clotting cascade is very, very complex. And once it gets activated, it can go literally out of control. The last risk factor that I'll mention here for DVT is increased age. DVTs are seen much more commonly after the age of 60. But here's the good news. DVT is often preventable, and here's what you can do to prevent it in your own body and in those that you care about. Move more regularly and more frequently. If you're on a long car ride or a long airplane flight, make sure to get up, stand, stretch, and walk every 30 minutes or so. I always recommend that. Doing toe ups while you're seated also moves a lot of blood in the lower extremities. And some people even recommend trying to sort of draw the alphabet with your feet to move the blood through your calf and through your thigh and back into your circulation. It's a fun thing to do, and it's not so easy to do, but it keeps you occupied on a long car ride or plane ride. And of course, stay hydrated. Drink plenty of water. Keep your blood nice and thin and prevent it from thickening up, especially on those long flights. Also, wear compression stockings if you're at risk, if you have any of these risk factors, or if you're traveling long distances. I always say when flying, avoid alcohol because it can dehydrate you. You may be urinating a lot on a flight if you have a few drinks, and so you have the false impression that you're well hydrated. In fact, you're dehydrating yourself because alcohol is what we call a diuretic, so it causes you to pass more urine than you normally would. Also, maintain a healthy weight. And of course, quit smoking. Seriously, this is one of the best things you could ever do for your vascular and cardiovascular health. And again, get moving and stay moving. Daily walking and general exercise is the best thing overall to improve blood flow and lower your risk of deep vein thrombosis. Watch for these signs and symptoms of DVT, swelling in one leg particularly, more than both legs. Single leg swelling is a real sign that something bad may be going on. Also, pain and tenderness, especially in the calf area, with warmth or redness in one of the limbs, is another warning sign. A feeling of tightness and heaviness, also a risk factor and a warning sign. Remember, some DVTs cause no symptoms at all. So if you ever suspect something's wrong, if you just don't feel right, if your legs feel heavy, uncomfortable, or different in some way, seek medical attention right away to be evaluated properly. In order to diagnose a DVT, we use what's called duplex ultrasound, ultrasonography, sonogram. You've heard all of these names, where we use sound waves that are not audible to the human ear, but create pictures on a screen where we can actually see inside the body without radiation and even without magnetism, just using simple sound waves. It's quite miraculous. I use it in my office, in my practice, every single day. It's non-invasive and it's highly accurate. There's also something called a D-dimer test. Now, that's a blood test that can be done to help rule out clotting, especially in cases where you don't have tremendous signs or symptoms, but again, you feel that something may just be off and you know that you're at risk. A D-dimer test might be helpful. Sometimes a CAT scan or a MR venography for more complex situations, or situations where we're worried that there might be a clot in the abdomen or in the pelvic area. Those may be useful tests in those circumstances. Now let's talk treatment. First and foremost, the treatment is blood thinners. Once we know that you have a DVT, your doctor wants to get you on a blood thinner right away. Now, blood thinners don't dissolve clots, but they do keep them from growing and expanding. It's what we call thrombus propagation, where more platelets and sticky blood elements want to stick onto that clot and make it grow. So the blood thinner not only stops that clot from increasing in size, but it also does what we call stabilizes the clot. It creates cross links in that clot that make it firmer and tougher and not so gelatinous and loose and easy to break off. And it also helps the clot stick to the vein wall so that it won't travel and move to the heart and to the lungs, which is really important. This reduces the chance of pulmonary embolism. Common blood thinners that you may have heard of are heparin, which is given either intravenously or by subcutaneous injection. And then there's low molecular weight heparin like Lovenox. And there's a group of drugs now that we call DOACs, DOAC, which are direct oral anticoagulants. Some of the ones that you may have heard of, the trade names are Eliquis, Xarelto, and Pradaxa. There's also Coumadin, which has been used for many, many years, still used in some cases in the right indications. The drawback of Coumadin, although it's highly effective, is that it does require blood testing to make sure that your levels are in the right zone and that it's effective and that you're not overly anticoagulated, which can lead to bleeding. Now, most people with a DVT or deep vein blood clot are going to be on these medications for 3 to 6 months until they're either completely dissolved or they become so chronic and sticky and organized that they're no longer a threat to you. In some cases, you may need to be on them longer, depending on what your personal history is. Some patients stay on blood thinners for life. When medication isn't enough, intervention may be necessary, meaning some kind of a procedure. One of those is called a mechanical thrombectomy, which is done through a catheter, and basically various devices can be used to pull that clot right out of the vein. They're physically removing the clot with those procedures. Sometimes a balloon angioplasty or stenting is required if this is a chronic problem or there might be some kind of external pressure on the vessel. The balloon and the stent are used to open up that vein and help clots from not forming again in the future. Sometimes in severe cases of big blood clots, we can use what are called thrombolytics. These are powerful medications that actually dissolve clots. One of those would be TPA, tissue plasminogen activator, and those can be delivered through a catheter directly into the clot to literally help it melt away. And oftentimes, if that's done, a vena cava filter is used at the same time so that if small pieces break off, it will be trapped by that vena cava filter, and those pieces of melted clot won't get to the heart and lungs. So those are typically reserved for life-threatening or limb-threatening DVTs because they do carry a higher risk of bleeding. That thrombolytic therapy carries a higher risk of bleeding and complications like hematomas and things like that. So that's going to depend on the size of the clot and the severity of the clot. And that treatment can sometimes only take a few hours, but it can also take a few days depending on the patient's situation. During that time, typically patients are in the hospital, closely observed, and at bed rest. One of the other things that can sometimes be done with DVTs is that an IVC filter can be placed. This is a small metal device that acts like a little bird cage or a little trap, and it's placed in the vena cava, which is the biggest vein in the body and the belly. And this way, if a blood clot travels up from the lower extremity, from the legs, it'll be trapped in that cage and won't be able to get to your heart and lungs. Typically, that's reserved for patients either who can't take a blood thinner or those who've developed DVT despite being on a blood thinner, which can be a problematic situation if you're still forming blood clots while on a blood thinner. And you're going to work with a hematologist in that case to figure out why that's happening. That's a very special set of circumstances. Now, even after a DVT is treated, some patients develop what's called post-thrombotic syndrome or PTS. This can cause chronic pain, swelling, and skin discoloration. And it's generally caused because after the clot has been healed or has been in place for a very long period of time, it causes what we call synechia, or a web-like system of scars inside of the vein that can obstruct normal blood flow and lead to chronic swelling and skin discoloration and, as I said, pain. This can even lead to leg ulcers where you develop open wounds in the leg area, typically the inside of the ankle, but they can they can appear in other areas. Dietary supplements like micronized purified flavonoid fraction, also known as MPFF, which includes diosmin and hesperidin, have been shown in some studies to hold promise in supporting healthy blood flow in the venous system in patients with PTS or post-thrombotic syndrome. So remember, early treatment and prevention are absolutely critical. We have to do the best that we can in these areas. And remember that deep vein thrombosis can be silent, it can be sudden, and it can be potentially fatal. But it doesn't have to be. So be aware and look for these classic signs and symptoms. Know your risk factors. Take preventive steps as much as you possibly can. And seek early help if you suspect a problem so you can protect yourself and your loved ones. If you found this information helpful, please subscribe and like and share this video with somebody who might benefit. And leave your questions and comments below, hopefully kind ones. I do read them all and I try to respond to them all personally. Thanks for watching. You may want to check out my video on varicose veins. The link should be right here. And talk to you again soon, Dr. Chuback.